was hearing and listening the incredible testimonies and the incredible power that you are bringing throughout. So I am really delighted to share my experiences, and I will share my screen. Can you see it right now? Yes, great, thank you. Thank you so much. I will share my experience like, a neuroscientist working in a very isolated way, in the sense, isolated at both levels, I would say disciplinary and also personal levels, and evolving through a completely different moralistic approach to bring health, and especially with a huge focus in art and creativity. So thank you so much for giving the opportunity to share my experience. I just want to start. I am from Argentina. I am a neuroscientist, a typical researcher. In the past, I was publishing a lot of paper, doing just focused research, and doing the business as usual in the field of neuroscience. But my father got dementia, and as happened usually in Latin America, my sister, she was taking care of him. In Latin America, more or less between the 70 to 90% of the caregivers are women, or wife or daughters. But I was a researcher studying brain health and studying dementia. My sister say, "Hey, I think that you need to, take care of your father." So I come back to Argentina. Very happy to reuniting with my father, thinking that all will be great and wonderful, and it was just terrible. So my father had a kind of dementia that was very behavioral. So he became paranoid. He couldn't make any of, the independent daily life activities. And supposedly I was a well-educated researcher in dementia, so I should be able to manage him, but it was not the case. I was trying to work as a good caregiver, but I was a really bad one. I never recognized my father as having dementia. I never get enough awareness. At the same time, we didn't get any adequate support for the health system. And so for me, it was a terrible moment in my life. I became a little bit paranoid, and I became, completely disorganized in my own behavior. So the dementia of my father had a huge impact in my life. But then I started to realize that this problem is not an individual problem. In Latin America, we have, together with Africa, I would say, and some region of Asia, we have a really, really challenging scenario for the next 30 years, where dementia is going to going up. Between in Latin America, it will be between the 100 to 250% in the next 30 years. We have a very fragile health system. We have a huge lack of awareness and prejudice against dementia. So this is not only my personal problem anymore, and I started to realize that we need to work together to make changes. My first step was creating the Latin American and Caribbean Consortium on Dementia. At the beginning, we were just, something like seven people trying to address the challenges for the region. Now we are more than 300, and we have been able to publish the real local needs that we have for dementia. The other problem that we have in brain health, in neuroscience, and in dementia research is that we tend to think that there is an universal approach to solve the problems of dementia. And this is wrong. The Global South have a completely different horizon for dementia in comparison with the Global North. That means that, we have different genetics, different cultural settings, different socioeconomic settings. We have different tools and different barriers. So a kind of universal approach where most of the research comes from the North, applied to the South, can be a really big issue. We need to develop our own research agenda. We need to understand what is the best strategies for the own region. So with the Latin American and Caribbean, we created a regional plan for dementia, identifying what are our challenges that we need. How, for instance, caregivers in Latin America are among the people that have the largest burden, because we have less than 1% of long-term care. The caregivers are, as I mentioned, most of the time women. They don't have any kind of support. They don't have any kind of financial or educational support. Um, and we have, big families, strong families, and this create bonds. But at the same time, this create a kind of informal care without formal support that create a huge impact in the stress and increase the risk of mental and neurological conditions in the caregivers also. So we started to highlight these issues, and I'm pretty sure that this happened also in Africa, or other region of Asia. So the kind of solutions that we need are different from other regions that already have a robust health system, or more education, or less prejudice. So this was a very nice first step, trying to develop this more, common horizon in the region, and looking for tailored solutions, or solutions that we really need in our own region. Then also I created the multi-partner consortium to expand dementia research in Latin America, or BrainLat, because the problem that happened in the life of the people also happened in research. For instance, we don't know almost nothing about the genetics of dementia in Africa or Latin America. Most of our models for trying to develop, genetic therapies are based in the research that comes from a subset of the population. The same for the language, between 70% of the people speak English in the world. The rest of the people doesn't speak English, but most of the neuropsychological assessments are created for the North and in English. So we have started to develop local research, understanding the genetics in the South, in Latin America, but also understanding the huge impact of social determinant of health and socioeconomic disparities. It's not only the education or the income, it's also where do you live, what is the kind of community context, what is your economic stability, how is the access of your health system across the lifespan. So we have been able to integrate these both sources of heterogeneity and diversity, genetics and environmental socio-economic disparities, and understanding that they have a huge impact in the clinical, cognitive, and brain outcomes of dementia patients in the region. So I hope that our region can bring a more diverse, more global understanding of the dementia, and being aware that there is not a single model of dementia, that we need to develop tailored models. But then we started to realize that there are many things that can be done for the patients. Currently, there is not cure for dementia. Probably you are familiar with some recent developments in therapeutics, but those therapeutics are extremely expensive, probably won't work for the next 10 or 20 years for Latin America. And in addition, these kind of therapies that are based in antibody meds requires a strong exclusion criteria for people that have vascular problems. So Latin America is full of cardiometabolic disease, including diabetes, obesity, cardiac diseases. So probably if we just wait for this kind of pharmacological interventions, it will be not enough and it will be too late. So with an amazing group of artists across the region, across Latin America and other parts of the region, we are starting to do something for the families there. So using art and health for patients with dementia can have huge impacts. And we just started to provide visibility for the people, just to showing what so many people in the communities are doing, like, people that is in Argentina teaching tango dancing for patients with Parkinson's disease. And this not only improves, the control of movement, this also improves, the cognitive aspects. There is some cognitive process called executive function that provides, your ability to planning, sequencing, organizing your mental states. And this can be really, really improved with the tango dancing. Also can improve, motor problems like the freezing, that is a kind of motor problems that the patient with Parkinson have. But also, this tango dancing helps to fight the isolation. In Latin America, isolation have a huge impact in your mental health and in your brain health. So creating a community, creating, empathy, coordination, and social interactions are critical factors to fight the impact of dementia and neurodegeneration. We also have been trying to put in contact artists that work in completely different settings. This is so important to understand, the different cultural backgrounds and how we can learn from different cultures. This only can be done if we bring artists together, if we put all the artists together to try to develop these kind of approaches. We started to work with ex-combatants and victims of the civil war in Colombia, doing mindfulness, doing music, doing dance, doing theater. And this can have a huge impact in the future of the young generation. So we are looking forward to explore more. But, I am a neuroscientist. And as a neuroscientist, I have been struggling between the kind of two culture divides. Snow, a great writer, wrote a book about these two cultures. One is humanities and another is science. But these kind of divisions that we have, in our education, it doesn't happen in real life. There is not something like a culture for one side and biology for another side. Culture and biology are coming together. And the environmental factors, the socioeconomics and socio-emotional context have a huge impact in your health. We need to understand that if we want to create scientific models to understand how arts and creativity have these, benefits on this health. So first of all, imagine this lady, let's call it Juana, from one country from Latin America. She's exactly the same person, but she lives in two different contexts. In the left side, she lives in a rich, safe, and really, really secure context, where in the right side, she's living in a very socioeconomical and socio-emotional deprived context. So the health of Juana, being exactly the same person with the same genetics, with the same biological predisposition, it will be completely different if he lives in the context left versus right. So if she have healthy environments, and she have time to do healthy habits, she have lower level of stress, she can do exercise, she can have a financial stability, and she doesn't have to care about the basic needs. So she will develop probably a better efficient self-regulation that is critical for your emotional and your interoceptive autonomic health, because that impacts, your cardiometabolic system, your metabolism, your inflammatory process across your whole body, and even the risk to develop neurodegeneration. This also, in particular, impact the cardiovascular system and your heart health, and also impacts specific networks of your brain, like the allostatic interoceptive network. That is a network that is, regulating the internal responses to environmental demands. When those environmental demands becomes, sustained in the time and under continuous stress, your body starts to create a lot of physiopathological process like inflammation, changing your immune system, changing your microbiome. And this create, this still start to trigger long-term negative impacts in your health. So there is here not a single causal model. Those factors are very complex and interact across different physiological systems in your body. And we need to understand that if we don't understand the impact that mental health, environment, exposome, socioeconomic impacts, and also, what you can do in response to this environmental demand, how you can change your behavior, how you can enrich, your brain health. We are never going to be able first to change the reality and also to understand why health have such a big impact. I want to say also there is a long tradition in medicalization of brain health. And we need to understand that we can do a lot for prevention, and we can do a lot with non-pharmacological interventions. For a long time ago, most of the people working in health system tend to think that the pharmacological intervention have a stronger factor than the non-pharmacological ones, like arts or you kind of uh, creativity interventions in general. But this is not true. We know very well, for instance, the pharmacological interventions for depressions have a very small effect, and they come with a lot of secondary effects. The same we can say for dementia. We don't have a cure for dementia. We don't have affordable, massive, scalable therapeutic solutions for the patient of dementia. At the same time, we start to measure the impact of different creativity interventions. We need to create a scoring. We need to create measure to understand how creativity really impacts in the health. I am so glad that the Lancet Commission is going to launch recently for the next year several papers to understand how creativity and health impacts different disease in a positive way. So we need to move forward from this cultural and biology divide and try to understand that the brain is embedded in a body, in emotions, in a context, in a social context, and with other people. If we don't move from this view, we are going to miss a unique opportunity to develop better science about how creativity impacts in health. And I say better science because we need to show that. We need to create a scoring of that, because that allows, to the health system, the minister, and the policymakers to support artists. Probably you have a similar experience in Latin America. The artists that work in health are completely neglected. They are not getting paid just for offering service. That all depends on the will, on the, good intentions of the people, but they don't have a recognition. So we really need to create mechanisms first to show the huge impact of creativity in health, but then, to create a formal system. So the Minister of Health or the Minister of Development can create programs and can pay for the people that work on that, and can bring more hope and benefit for patients that are, long waiting for curing the disease through medical interventions that are not robust enough. So thank you so much. This is the message that I want to share with you. I'm happy to talk more or discuss with you any issue.
Thank you very, very much, Prof. That was, there's evidence of passion and fire in your voice. Thank you for sharing your light and teaching us a lot. Quite packed, but we're going to hop swiftly to the next speaker before we will do our Q&A later. We will have Kirti Ranchod, a neurologist, a brain health consultant, co-founder and chair of Africa Brain Health Network, a Global Atlantic Fellow, a transformation neuroscience into practical, transforming neuroscience tools into practical tools for better brain health. Thank you very much, Kirti Ranchod. Over to you. She is first and foremost, as we were taught by Sheila, human. Over to you.
Thanks, Gsahw, and thank you, Kunle. It's really exciting to be here. I'm going to start. Can everyone hear me? There's the Zan in the background. I'm just not sure if it's clear now. Yeah, okay, cool. I'm going to start with a quote with the Ethiopian-Australian academic and poet, Yiga Galaw Waldeis. And he said, we lived in a world where tradition gave rise to knowledge, and that knowledge allowed us to live well in the world. In essence, that what we had in our traditions actually allowed us to live because we learned from the environments that we were living in. Now, globally, people have had and have systems and approaches to health, to healing, and well-being. And these systems have been built over generations. They have adapted to different resources. They have adapted to changes in the environment. And many were holistic and integrated. They considered not just the individual, but the ecosystem around the individual to actually support health and well-being. And as a neurologist focusing on brain health, when I started looking at all the activities that that led to better brain health, I realized that so many of these were actually embedded in my culture and the cultures that I was surrounded by in Johannesburg and on my travels. So, and we often did not consider them a resource per se, but also we did not use the specific terms that were used in the research literature. So terms such as intergenerational living or meditation or mindfulness or social interaction or brain stimulation, or even the arts, because even the arts in terms of the way it's used so often within our traditions, our cultures, our communities, or our families is so integrated that we don't use the word art to even describe them, right? The arts in our systems have always been very functional and practical in a sense. They have been used for health and healing, and I'll give us specific examples soon. They have been used in our rituals. Like I remember, and this still happens before Diwali, where there's this specific patterned powders or rice that is actually put outside a house, but it's a specific art form. They've been used in our rituals, in our marriages, our ceremonies to respect and actually manage death, and in our other celebrations. They've been used in our prayers. The arts in all its different forms have been used in our prayers to our gods, to our goddesses, to our ancestors. And it's this functional aspect of the arts that are so integrated that I think sometimes gets overlooked when we discuss art and when we discuss health. Part of what I do in terms of supporting brain health is really understanding the value of this cultural capital, the arts and everything else that we have to actually support health. And that we need to consider the whole and include knowledge systems and people who typically get excluded when we talk about a health system, when we talk about knowledge, when we talk about education. So I'm going to take you to this beautiful part of South Africa, Limpopo. It's in the northern part of South Africa. It borders with Zimbabwe. And it really is one of, I have lots of favorite places in South Africa, but it really is one of my favorite places in South Africa. And there really are baobabs that are thousands and thousands of years old. There's a cycad forest, the Mojaji cycad forest, that's millions of years old. It's a part of South Africa where they literally grow everything, lychees, watermelon, cherries, oranges, you name it. It's a very rich, fertile soil. There's also a mix of lots of different people, both indigenous and immigrants, speaking a host of different languages. And it has an absolutely vibrant art culture. One of the artists that I'm going to be discussing is a sculptor, and his name is Dr. Phuthuma Siyoka. Now, many years ago, Dr. Siyoka was having these recurrent nightmares that meant that he could not sleep at all. And I was introduced to his work on a visit to one of the art galleries in Johannesburg, the Wits Art Museum, and his sculptures were there. And one of these sculptures was his actually wrestling a snake that's larger than him. So you can get the magnitude of how dreadful these nightmares actually were. As treatment for his nightmares, he went to see a traditional healer in his village. And the traditional healer told him to sculpt. And that's how he became a sculptor. Now, what profound advice for help. What profound advice to help him to deal with these nightmares. the traditional healer understood the power of arts and the power of sculpture to actually help Dr. Sioka. I'm going to explain some of the neuroscience behind art, but I want to also emphasize that the neuroscience in this setting is complementary. This traditional knowledge system had a wealth of knowledge, wealth of resources, and understood the power of arts without the neuroscience behind it. The neuroscience is complementary. It allows us to understand. It doesn't detract from what the traditional healer knew and what the traditional healer practiced. So how does art actually help the brain? I love art. Really been fortunate to have it integrated into my life, my entire life, and used it throughout medicine and throughout neurology, both to cope and to actually understand medicine and neurology and difficult concepts. So I really do love it. So when I came across the neuroscience of this, I was super excited actually. What does art do to the brain? One of the things that it does is it activates a network in the brain called the default mode network. Now, the term is rather dreadful, but it does say what it does. It's the brain in essence at default, when you are not engaging with the outside world, but when you are internally engaging or reflecting. So what it helps with is understanding ourselves by actually facilitating a process of autobiographical memory of ourselves. It allows us to project it to the future and to imagine our future selves, and in the present, to understand ourselves and to understand potentially people around us. Now, when you think about it, how does this help us then? We understand ourselves better, we can make better choices for ourselves and problem solve with regard to self. The other thing that art does is, there was a small study where they actually looked at people who were creating art, and they measured heart rate, blood pressure, stress markers, and psychological resilience. And they found that people who were creating art had reduced heart rate, reduced blood pressure, reduced cortisol levels, which is a marker of stress, and improved psychological resilience. So what the traditional healer offered to Dr. Sioka was a tool to empower him to understand himself, make this very unconscious, a subconscious problem that was giving him these nightmares tangible. And with that, allow him to actually deal with this problem in a very real sense. It gave him a method to reduce his stress levels, manage his stress, and improve psychological resilience. Now, isn't that incredible? And as Agustin was also mentioning, there's nothing in my medical training that would have allowed me to prescribe arts at that point. Things have changed a lot, but there was nothing at that point to say, as a medical doctor, I could offer arts to my patient. I would have been almost obliged to prescribe a medication. A medication does help. I am still a traditional doctor as well, and or biomedical doctor, and it does, and medicine is really powerful in a certain setting. But we have this wealth of knowledge around us that can actually support health in a whole cohesive way that we have tended to ignore and to minimize. And this is the challenge. If we really are committed to supporting health, we need to include these different knowledge systems and different people with respect and equally, so that we can support better health for all of us. And really, if we think about solidarity within the global south, it requires us as a whole to start looking at how we define knowledge, how we define education, how we define our health systems, to be more inclusive of health systems that we have had for millennia throughout our cultures, traditions, communities, and not in a static, fossilized museum form of it, but in a form that has always responded to challenges, resources, needs, new information. Our systems have also adapted with time, like a university, medical, or scientific system as well. once we start doing this, we really have the opportunity to increase access to health and really work on a proper vision and map towards equity in health. I'm going to end soon, but I want to emphasize that within our traditions, within our cultures, within our communities, or within our families, because we are not homogenous within our cultures or traditions either. Within this, we have a wealth, and this is our cultural wealth, our cultural capital. We need to invest in this cultural capital, nurture this resource, and grow this resource for our health, and really so that we can enjoy the lives that we have. Thank you.
Wow. Thank you very much for that one. Very heartfelt as well, a different dynamic to the conversation that we're having. And I love how we embrace our culture and where we come from in all of this. Without further ado, I'm going to call Udeh-Momoh, a translational neuroscientist, co-director of Imarisha Center for Brain Health and Aging, Brain and Mimd Institute, Aga Khan University, Kenya, and Pakistan. An assistant professor as well. We are littered today with profs and academics, you know, we're blessed. Co-founder, Female Brain and Endocrine Health Consortium, and a leader of Africa Fingers, a Global Atlantic Fellow in Equity for Brain Health as well. Over to you, such a rich profile. I'm already very eager to hear what you have for us. Over to you.
Thank you so much. It's such a pleasure to be here. I'm so grateful to the organizers, to Kunle, you know, for the invitation to share here. But I have to say, I have learned so much. True confession, I grew up in Africa, and at that time I always wanted to be an artist. But if you know anyone from like Global South will know, like your parents say you have to be a doctor. And I'm truly pleased that for this opportunity now to start to integrate arts and creativity and really show that side, you know, with science and medicine for promoting brain health. So these are my affiliations. And like I was mentioning, I was born in Africa, grew up in the UK, but I want to talk to you about the work that I'm doing in Africa, really trying to think as outside the box when it comes to strategies for promoting brain health and preventing or reducing risk of burdens of diseases that are so prevalent. I'll start by showing evidence for this work, you know, especially in underserved regions in Global South that have just been completely ignored in most of the efforts towards brain health promotion. I'll talk about the work that we're doing with our worldwide fingers and how we're adopting creative approaches to try to address this gap, you know, in brain health inequity. And in the spirit of this conference, which I love as it's super collaborative, I would really like the option and the opportunity to explore ways of collaborating with the talent. I mean, the apps, I've been blown away all day, all morning. And so really the opportunity to collaborate with people for this work. So I want to start with just shedding some light on, you know, the burden of dementia in regions like Africa. And this map just makes my blood boil, not just because it's red, but because of the actual data. So this is the showing the projected prevalence of dementia, the burden that we can expect in regions like Africa, like in Latin America, in South Asia. And it's so sad that it's so great, and yet till date, there's less than 0.1% of research in this disease in Africa, or I should mention in South Asia as well. And what's even worse is that when you try to start to think about the markers and the factors that are linked to, you know, dementia in these areas, especially in Africa, I mean, there isn't even one single Alzheimer's disease related biomarker study in an entire continent. So, you know, being a scientist, you know, in the UK, I struggled with this fact, and I just couldn't continue on in the trajectory. And I thought, you know, have to do something about this. So we know that the population is aging, and we also know from evidence that's been reported extensively now that there are protective factors that kind of provide, you know, some or augment resilience against the onset of dementia in people who may even be at high risk of developing dementia. So I took some data from a Nigerian cohort, and I wanted to see what the predictors of dementia would be. And to my surprise, the factors that predict whether or not somebody is going to have dementia at follow-up were protective factors. So there were modifiable factors. And what that speaks to me is that's an amazing opportunity for prevention, because if you can prevent or reduce the risk of dementia, targeting these modifiable factors like social engagement, some cardiovascular burden, smoking. If we can reduce the risk of dementia in people who are already at high risk, for example, we're onto a really good start. So there is a consortium called the Worldwide Fingers, and they're the first people globally to it was a study done in Finland, and they were the first to show any sort of benefits using a lifestyle-based intervention, so behavioral modification, to reduce the onset of cognitive impairment or memory problems in people who are already at high risk of developing dementia. So that this project has now expanded to over 60 countries. You can see all around the world, but very, very few studies in Africa. And so I'm fortunate to be biomarker lead for this for this network. And so one of the remits for my role was to try to start to think through ways we can initiate much needed studies in regions that are underserved. And so we launched the Africa Fingers Network back in 2018. And it's a regional initiative that's multinational, where we're trying to develop more contextual strategies to promote brain health and reduce the risk of dementia in Africa, so based on the finger model, but also to address that biomarker access inequity will be deeply phenotyping people in terms of collecting samples and markers that will help us to be able to very early on detect changes in the brain, so that we can go on with this lifestyle-based intervention. And this is such a nice segue from the last two excellent speakers, with Agustin talking about the need for thinking outside the box when it comes to just thinking through pharmacological interventions for promoting brain health or addressing dementia, and Kirti mentioning that as well, even within her own practice. So our Worldwide Fingers team has now expanded to about 44 members across 10 sub-Saharan African countries. Recently, we're onboarding Egypt, so that will be 11 countries. And we had an informal launch back at the largest Alzheimer's conference this year. So I want to talk about how we're planning to do this, because I think the focus, I think, of this presentation is really about how we're adopting the arts for the work that we're doing. So as a first step, before going guns blazing with an intervention, we sought to just thinking through, we're working in Africa where storytelling is, it's really like everybody. If you want to target people, if you want to get them interested, you can't just go in telling them about how to change or modify behavior. The important thing is knowing what does aging gracefully and aging healthily look like. And so we started off as a first step with an ethnographic approach that allows us to really hear from the community in terms of their lived experiences of people living with dementia, but also thinking through how does this person who's lived to 120 years, how did they do it? What are those strategies? What are those I love, there's an album by Fela Nicola Kuti I grew up listening to called Suffering. It's like Suffering and Smiling, and they talk about this, you know, with a lot of Africans, you know, despite all of the issues, people still are so resilient, and really trying to understand what those resiliency factors are through storytelling is one of the core goals of this project. So we're investigating people's knowledge and their attitudes and perceptions of dementia risk, because by adopting this community-based participatory research approach, we're then able to hopefully develop strategies that will be more suitably adopted and adopted for the longer term, so that it's scalable and is sustainable. And what we're doing here is for the FemBER or the Worldwide Fingers in Africa project, the interventions that we're focusing on is going beyond what the original FemBER study did. So we're leveraging, you know, knowledge from FemBER and the US Pointer studies, which also is another FemBER-based trial in the US, the Latin America FemBER trials, around about 13 countries in Latin America. And we're taking into all of the lessons that they've learned to really think through, at least for Africa, how can we design with our communities more culturally sensitive modes of lifestyle intervention? So one example with physical exercise, if I go to a grandma, you know, in Kenya or Ethiopia or Egypt and say, oh, I would like you to go to the gym 5 times a week, they'll probably look at me like I'm speaking a different language. So, you know, we've culturally adopted this with our community to say, well, something, a physical exercise, and this actually worked in Latin America, where they changed the going to the gym to salsa dancing. So we're using African traditional dance. And then for cognitive stimulation and cognitive training, I'm so excited to work with Kunle Adewale on this, where we're using augmented and virtual reality, so mixed reality platforms, but incorporating that with arts-based therapies, so board games, goal-setting tasks, to really think through more culturally sensitive and culturally appropriate ways of helping people with training their brains. With nutritional guidance, we're really going using another cultural tools, but also really thinking through monitoring health. We already know from the data I showed previously that there is a great vascular burden and cardiovascular burden in these societies, and so addressing that is going to be crucial. But we want to go beyond that and look at other factors that have not really been approached, which is things like sleep quality, things like, you know, your sensory qualities, so your eye health, hearing loss, you know, alcohol as consumption, and smoking cessation. And so we're doing this across 4 different countries in the first instance, and we're doing this more importantly with our local communities, so they are heavily vested in the approaches that we're working on. So our plan is to extend these protocols to larger populations. So take the lessons we've learned from Africa, you know, to cohorts in the UK, in the US, but also really expand into real world settings across our Kenya and Pakistan surveillance sites. And we're doing this we're leading this from my lab in the US. And I want to also, just in the spirit of Ubuntu, which any African will understand here, but it's really linked to this African proverb that if you want to go fast, you can go alone. But if you really want to go far, and given the burden that we're expecting here, we have to go far, and to do that, we need to go together. So I'm opening this here because I'm trying to build a tent of collaboration, because I don't think one person can achieve this. I think it's going to have to be a joint effort, really. So I'm really excited about the spirit of, you know, the Global South Arts and Health Consortium, in the spirit of collaboration and really asking for how we can do this together. Kirti mentioned the baobab tree, something that I really hold, I see a lot of significance in, because when it comes to dementia or even brain health research, even though that we're thinking of rooting locally with the work that we're doing in Africa, it's so important, like the baobab, that we branch globally and really expand and extend the work that we're doing so that immigrant populations in the diaspora can also benefit from the work that we're doing. So I'd like to thank you know, a lot of people, too many to name, but a lot of sponsorship and funders. And thank you so much for your attention.
Thank you very much, Kitty. I definitely gave you undivided attention. You know, today's conversations around tables are quite amazing. I'm actually short for words. On the chat, we don't have much questions. A professor I had a while ago said, questions are not there when everything is crystal clear, nothing is understandable, or everything is exceptional and everybody is mesmerized. And I think it's the latter. You know, the comments, I love the inclusivity for migrants, amazing talk, love your passion. Would be so interested to explore collaboration. A lot of collaboration opportunities on chat, please do visit them. This is so essential, to include and engage the community. Amazing holistic approach. So it's a really positive comments to all speakers. I'm so glad to see arts and medical sciences coming together. And one for me there when I said it's amazing to have a twist that includes, you know, our culture and who we are. Kitty spoke of Ubuntu. What is life without Ubuntu? I mean, after all, we are human. I think I have a question, and that is the question for yourself, Kitty, where you spoke of the you know, the intersections with culture. We've seen, especially with development, that you know, there are backlashes or viewing, you know, the culture, especially of the South countries, as a bit more primitive. How do you then penetrate in an environment where, you know, a lot of there isn't a lot of cultural diversity or acceptance in such cultural practices?
I don't think I completely understand the question. Do you mean us as a medical system, or do you mean within a system that's not, yeah, not completely sure.
So mostly within the medical system, we've seen that the medical system has more of the Western ways. And when you come in with the traditional ways, what has been the reception, and how do you then break through the barriers?
I must admit, I do think integration between different knowledge systems would be exceptionally difficult, particularly given my clinical experience. But I think what we need to move forward with is a way to engage with respect and understanding and an open mind, and to accept that we're not always going to agree. Even if I disagree with your approach to health, your choices to support your health, how do I still engage with you respectfully? And I think that's what we need to do. I actually did publish an article with a Brazilian psychologist who's also from an indigenous community, and he works a lot with indigenous communities. And it's about how do we create the spaces and manner of engagement becomes really foundational to how we go forward to do this work.
Thank you very much. I think this is for all of you. Sorry about the banging sound. There is a question for, I think, all of you, whoever will be the taker, from Sheila. My father had dementia, so I know there's a probability for me to have it. Is there something I can do to help me prevent, I believe, prevent me from getting it? Because I got the impression that it could be. Any takers?
I'm happy to kind of because obviously the work that I do is really looking at people who are at high risk of dementia and trying to find ways to reduce that risk through behavioral and lifestyle modification. So there is overwhelming evidence now, and even from the FemBER trial, where people who are at high risk due to genetic risk, they actually benefited more from the lifestyle interventions. So for example, so I'll tell you what, so it's the finger model is about, 4 fingers, but embedded within a social engagement framework. So you have physical exercise, you have diet and nutritional, so making sure you have a healthy diet and making sure you're stimulating and activating your brain, so brain training, and also monitoring your cardiovascular health. But very, very important. And I actually think that the hallmark, maybe because from my explorations, really deep diving in the African setting, and I'm seeing that even more importantly than having stroke or cardiovascular health, if you have low social engagement, that's a higher risk for dementia, than any of these clinical factors. So there is such a great need for the community spirit in what we do. And I think, and I love the fact that, so there's been studies comparing data from people living in Africa versus people living in the diaspora, where I think that there's less community engagement, and you always see that the burden is always greatest in the immigrant population compared to the indigenous population. So I think that there is a huge need for us to really come together, even in this way. We're releasing very nice endorphins, we're all smiling, we're all happy, and we're laughing, and you have no idea how medicinal that is. So I think that it's great to adopt those lifestyle behavioral modifications, so healthy living, as Agustin showed on his slide, but very, very importantly, don't ever forget the need for social engagement and community spirit in what you do.
Amazing, amazing. Thank you very, very much for that one. Very adequately answered. The next question is, what has been the biggest challenges you faced as you have been developing research and interventions in your contexts? What have been the strategies you have developed to meet these challenges? I think any one of you can take it. Maybe we can give it to Prof. Agustin, since he hasn't spoken.
Yeah, thank you so much. Happy to share my experience. So challenges are, so many. And the thing is how to transform them into opportunities, right? So this is not really a slogan. So first of all, the main challenge is money. In Latin America, there is no money for research. Governments just spend a few dots for that. So our strategy was bringing money from other places. So we systematically applied to US funding. And how you do that, that's the problem. So we know now that brain health and dementia really needs a truly global agenda. We need to address diversity. Diversity is not a problem that we have to control. It's not a variable that we have to covariate to see how we can generalize those models. Diversity is a core concept for brain health. It changed everything from biomarkers to genetic predisposition to environmental factors. So it's perhaps the most important aspect to understand brain health and diseases. So we put that message to get money from US and to, training our people. The other challenge is the lack of training. So we started to develop capacity building programs, training researchers, improving the diagnosis, creating open science frameworks where you can share your data, you can share your script for complex analysis, and you can put people helping, bringing tutorials and helping younger researchers to develop these tools. So the other thing that for me was very, very important is to develop this kind of horizon with shared horizon, because it happened to me in my life. I was very isolated and thinking that the problem that I have are my own problems, and I was like focusing in myself for so long. But then I started to understand that those problems are shared across so many researchers, so many other places. So thinking together brings more power than thinking alone. And when you think together, you can bring, money, support, attention, and you can start to dream big, to create changes that are beyond your own, smaller view. So I think that those are important activities. For the Global South, I think that we need to work more together. We need to understand, that if we don't bring diversity in the Global South, we are just ignoring the largest population that will suffer from brain health diseases. So we are responsible to change that narrative, I think.
Thank you very much.